Welcome and thank you for joining us for another edition of Health in the Heartland, a program dedicated to the health issues that affect you. Heart disease is the leading cause of death in the United States. In this episode, we will address prevention steps that you can take to become more heart healthy and also look at current trends regarding cardiovascular disease. Joining me is cardiologist Dr. Prabodh Mehta. Thank you for being here.
My pleasure.
Let's start with the terms that I just used. We hear heart disease and we hear cardiovascular disease. Are those two interchangeable? Do they mean the same thing?
They do. Heart disease refers specifically to conditions of the heart. And when we talk about cardiovascular disease, it extends the spectrum of heart disease along with disease of the arteries going to the brain, going to the legs. So it involves not just the heart, but the main pipeline called the aorta, its branches going to the brain, as well as the arteries that go to the intestines, as well as to the legs, commonly called peripheral vascular disease. So a combination of heart disease and peripheral vascular disease combines it to call cardiovascular disease.
And I think that's a good point, because when we hear the term heart disease, we just specifically think of the heart, but so many things are involved, yes, as you said. And we hear now too the arteries, clogging of the arteries, as you had just mentioned. So very important that we take care of ourselves so we can be heart healthy, correct?
Correct. And when you talk about the peripheral vascular disease, some people may have just symptoms or manifestations of the peripheral vascular disease, but over a period of time, what causes mortality or death in these individuals is condition of the heart. So peripheral vascular disease indicates that there is more than likely some underlying heart disease ongoing, and hence you have to treat the whole spectrum as one condition.
Well, what are some risk factors? Let's start there with risk factors our viewers might need to know regarding heart disease. What can they do to become a little bit more heart healthy?
The most common form of condition that precludes heart disease is hypertension or high blood pressure. High blood pressure, we have all learned, is called the silent killer. It has very few symptoms that cause you problems, but by itself it's a long-standing problem that leads to bad outcomes in terms of heart attack, stroke, problems with circulation to the leg, etc. That's the most important risk factor. The second risk factor is diabetes. Diabetes, again, is silently causing problems in the cardiovascular system that makes an individual go towards developing cardiovascular issues relating to heart attack, stroke, and problems with the legs in terms of circulation. The third most important cause of heart and cardiovascular disease is smoking. And smoking is extremely common in Kentucky. Although the incidence of smoking is going down, it's still a very major risk factor in terms of causing cardiovascular problems. One also does not commonly recognize that chewing tobacco is as bad as smoking, and it's not uncommon to have patients think that chewing tobacco is harmless. And lastly, obesity or lack of exercise and being overweight also tends to cause early heart disease problems.
And we've talked about obesity before because it can be a precursor. Obviously, as you
Yes.
gain weight, you become more at risk for hypertension, the high blood pressure you had
Yes.
mentioned, and diabetes. So what age, let's talk about screening purposes, what age should an individual start looking at knowing their numbers as far as their high blood pressure, or maybe getting their lab work done for finding out if they're at risk for diabetes, and or your lipid panel? Let's talk a little bit about that.
No age is early enough to be doing things progressively and proactively to prevent cardiovascular disease. And let's start off with the young adults. So anyone between the age of 20 to 25 should at least have their lipid panel or cholesterol panel checked once to make sure that that's not out of line, not just because of dietary habits, but because of genetic predisposition. We did not mention earlier, but family history of heart disease at a young age makes one more likely to have heart disease at a young age. And let's define the term family history. Family history is considered positive if you have brothers, sisters, siblings, or parents having heart problems at a young age, which means that males having problems below the age of 55 and females having problems below the age of 65 would be considered a positive risk factor for heart disease. Anyone who has had blood pressure that is in the high range at a young age needs to be even more careful about getting their self checked for the development of high blood pressure and its long-term complications. So lipid panel or cholesterol panel needs to be known by every adult, first time maybe between 18 and 25, and then maybe every 5 years.
Excellent point, and I think we can't stress enough to be really a wise healthcare consumer and start to learn your numbers and even track them, write them down, yes. Share them with your healthcare professional and partner with them in taking charge of your own health. Let's go back to the lipid panel because we hear that term or cholesterol panel. What actually is involved in what's tested?
The lipid panel consists of the total cholesterol. Then it has its subcategories. The three most important ones are the LDL, low density lipoprotein, or the bad cholesterol in lay terms, HDL, high density lipoprotein, which is the good cholesterol. It's the heart protecting cholesterol, and finally triglycerides. One needs to know that there is no one actual number for any of these parameters that is considered normal. Any given individual has a parameter of what is good cholesterol and bad cholesterol based on their risk status, not just a one defined number. And your healthcare professional can help you determine what is the ideal number or where your panel should be.
Very good point, because again, as we had just mentioned, partnering with your healthcare partner, your professional, you're looking at if you're a smoker and have different numbers versus a non-smoker, your weight, your family history, etc. So it all comes into play in making sure that you know your risk factors based upon your background and also your lifestyle and what you're doing.
And just to give you a small example pertaining to the numbers, is somebody who's already had a heart attack, their bad cholesterol needs to be below 70. But somebody who is 40 years old and completely healthy without any of the risk factors can have their bad cholesterol in the 125 and 130 range and considered to be appropriate. So don't get hung up on one particular number as a parameter for what your cholesterol should be. It depends on your underlying risk status as well as your age and other factors.
Good points. Now, we talked about LDL. What about that HDL? And we hear everybody wants that number to be as high as it should be. So is it different? I know we shouldn't get hung up on it, but is there a difference between a male's HDL and a female's HDL?
HDL, high density lipoprotein, should be as high as you possibly can get. Now, most women during their reproductive years have a higher HDL than males in the same age group. A female should have their HDL above 45 or 50, and males should have their HDL above 40. Any HDL below 40 is considered low. The HDL is the heart protecting cholesterol because it is the kind of cholesterol that takes away the fatty material from the inside of the arteries, and it is a scavenger of the bad cholesterol.
So it's helping to kind of clean it up, to say the least, in our arteries. We want a high number to get in there and help protect us. We hear a lot too with alcohol and, you know, having that in moderation. We know we need to do that, but also raising our HDL. Do you have any comments regarding alcohol and HDL?
Alcohol is known to improve HDL, but what is very important to know is the amount of alcohol that is beneficial for heart health. And most people commonly don't consider the amount of alcohol as being relevant. However, if you have 5 to 7 drinks a week spread out, that is considered heart healthy. Once you reach 7 drinks or more, it starts to hurt you rather than benefit you. And what is a nomenclature for one drink? one drink is equivalent to 12 ounces of beer, or 4 ounces of wine, or 1 ounce, 1 to 1.5 ounce of hard liquor like whiskey, vodka, gin, etc. But what's most relevant is to recognize that if you drink 5 drinks on one day, that's not considered heart healthy. What you have to do is to spread it out. And as a general rule of thumb, my advice to most people is that if you're going to consume alcohol, you should consume no more than 1 drink every other day. That translates into about 3 to 5 drinks a week, which is most beneficial in terms of cardiovascular health.
I think a lot of times too, people forget that alcohol also has calories.
Yes.
So you have to watch the consumption there. Again, we're not advocating drinking by any means, but you have the hidden calories. So you also have to watch the calories as far as the weight and the obesity that we were talking about before too. And again, also with the HDL, we hear exercise, that it's very important to be physically active. So we know that's going to help raise that HDL. And do you have any comments regarding?
Yes. And exercise is the best form for raising HDL. And exercise in terms of aerobic activity, about 5 days a week on an average, will benefit anyone who wants to raise their HDL. But what is most relevant is to recognize that even the smallest form of exercise is beneficial to heart health. For example, elderly people with arthritis, unable to walk very well, studies have shown that even if they walk 5 minutes 2 or 3 times a day, as little as 5 to 15 minutes 5 days a week, the incidence of recurrent heart attack or repetitive heart attack is less in the individuals who do some form of regular exercise than in those who do not.
So it's important to get moving, and we definitely need to start that at an early age.
And what is also very relevant is to recognize that exercise not just helps in terms of heart healthy, but it helps to control your diabetes, it lowers blood pressure, and many other beneficial effects of regular exercise. So you need to do what you can in terms of your physical limitations, but as you said, get moving, do something rather than sitting around.
That's the housework, the gardening, get moving, and if you can, take a brisk walk a little bit, as you said too,
Yes.
and not necessarily all in concentration in a hour period. It can be broken down to that couple 15 minutes, the 5
Yes.
minutes as you were alluding to also. We've talked a little bit about exercise, having some lab work done. What about our diet? What can we consume to be a little bit more heart healthy?
What is very important to recognize is it's not just to limit the calories, but the type of calories that you consume. In terms of carbohydrate, what is important to recognize is to avoid the white. That means avoid white bread, avoid potatoes. Eating healthy, more grains, more whole wheat in your diet is tremendously beneficial for various aspects of health. Secondly, it is important to recognize to limit your fat content. And as a general rule of thumb, those who are trying to actively reduce their cholesterol by way of diet, consuming red meat or fried food approximately once or twice a week is tremendously beneficial in terms of lowering your cholesterol.
So we've talked about diet and making sure that we eat a lot of whole grains, fruits and vegetables, and exercise to be a little bit more heart healthy. What's a good measurement for us to know actually if we are overweight, or the term that we're hearing, obese?
What is most important to recognize is take the whole picture into consideration. BMI incorporates an individual's height and weight into a number that is easily available by means of a calculator, or on the internet there are BMI calculators that will tell you that for your height, what is your BMI at present. An ideal BMI is somewhere between 19 and 24. So if you're less than 19 means that you're underweight, and if you're greater than 24, you start to become overweight. Beyond 30 is considered obese. Now, as you look around our high schools and middle schools and elementary school, you are starting to see a lot of childhood obesity. And what we need to recognize is that it's not okay to be overweight or obese as a child, because anyone who has that tendency to become obese at a young age, the chances of their being obese when they grow up or in adult life is extremely high. So weight tends to hang around, and therefore it is important to recognize that even our kids need to be eating healthy foods. Now, in terms of trying to quantify obesity, there is an importance to recognize that obesity that is more in the belly region is worse than the obesity in the thigh region, the concept of the apple versus the pear. But again, recognizing that it's not okay to be obese in the thigh versus being ideal. So ideal body weight is what we need to strive for.
And you usually strive for that again through diet, through exercise and movement, and that's what we've been talking about pretty much today as far as being heart healthy. Now, we talked a little earlier about some of the lab work, and we talked about the cholesterol panel. There are indications out there about some other lab work that can be done, such as a CRP. Tell us a little bit about that blood test.
CRP is what is known as the C-reactive protein. It is a crude test, but it tries to measure underlying inflammation in the body. And there are two types of CRP. One is a regular CRP, and the second is the cardiosensitive CRP or a high sensitivity CRP. This is, if your high sensitivity CRP is elevated, it's a sign of a vascular inflammation in your body. Now, it doesn't mean that anybody with high CRP is going to go on to have a heart attack. It's an indirect marker, and it has to be used in the right context. So if you already have diabetes or you already have heart disease in the form of having had a heart attack or blockages, then measuring high sensitivity CRP is irrelevant, because you need to be treated as a high-risk individual, need to be on aspirin, you need to be on statin drugs, the cholesterol-lowering drugs, etc. But if you're a relatively healthy individual, and if your cholesterol is on the border zone and you're trying your best to lower it with diet and exercise, measuring high sensitivity CRP is an added tool to quantify you in terms of your risk status. Give you an example. You have a 42-year-old male whose blood pressure is around 145/90 at the time of the doctor's first visit. And the doctor advises reducing salt intake, exercise, not using relaxation exercises, trying to exercise, losing weight, and lower the blood pressure by natural means. In this individual, when the cholesterol panel is checked and their LDL is, say, 155 or 160, the doctor might check them for CRP, and if the CRP is elevated, then he may decide to start cholesterol-lowering medication sooner than if the CRP is normal. So it's an added tool to help the doctor make some decisions about adding or not adding certain medications.
But not necessarily a lab work that everybody needs to have. It's based upon, again, as we had talked about earlier, their family history, their lifestyle, and everything else that's going, the whole picture, looking at the whole picture.
And again, we have to emphasize that any form of blood testing should not be done as a routine measure. It has to be done in the right set of circumstances with the right set of symptoms and disease states.
And just a snapshot at that point in time, right?
Yes, at that point.
Absolutely. Now we've talked, I heard you say something about aspirin. Tell us a little bit about what the latest information is regarding aspirin and heart disease.
In anybody with heart disease, those who have had demonstrated blockages in the carotid arteries or in the heart or in the circulation to their legs, once they know that they have symptoms or manifestations of blockages, they need to be on aspirin for the rest of their lives unless there is a contraindication or a problem that the doctor tells you to stop. Aspirin in the dose of 81 milligrams a day is appropriate for vast majority of the situation. There are rare instances where the doctor might tell you to take a full strength aspirin, and that you should do based on your doctor's recommendation. Secondly, aspirin is a cardioprotective drug, and also it's used for treatment of heart attack or heart disease. So when you take aspirin, you need to be cautious about the potential side effects of aspirin. there is a slightly higher incidence of bleeding complications related to aspirin. Or if you have a condition that makes you predisposed to bleeding from somewhere, aspirin may aggravate the problem. So once again, use or not using aspirin has to be based on the recommendations of your primary physician.
We can't stress enough really partnering with your healthcare professional and talking with them before you start something like that, right?
Yes, very much so.
What about vitamin D? Is vitamin D something that, in vitamin E, we hear these types of things in the fish oil. What comments do you have regarding general rule of thumb on that?
Vitamin D has become a very important factor over the last several years because of the recognition that low vitamin D levels is associated with a higher chance of heart disease. What we don't know is that does correcting this vitamin D reduce the chance of heart disease? There are studies ongoing where patients or individuals with low vitamin D are being tested. Half of them are going to get vitamin D, other half are getting placebo, and being followed over 5 to 10 years to see if correcting their vitamin D level does indeed reduce the chance of them having cardiovascular disease or problems relating to cardiovascular disease. At this point in time, we don't have clear-cut data to show that everybody's vitamin D needs to be corrected. So once again, you have to discuss your vitamin D levels with your healthcare professional. Secondly, use of vitamin E and antioxidants has now not been recommended because studies have shown that using vitamin C, vitamin E, and other antioxidants in a pill form does not necessarily reduce the chance of cardiovascular disease. And in certain situations, when they are combined with the use of statin drugs, might interfere with the beneficial effects of the statins. So as a general rule of thumb, the previous recommendation to take antioxidant vitamins for reducing the chance of heart disease is no longer is an acceptable problem.
So Dr. Mehta, before we would take anything over the counter, such as an antioxidant vitamin, the A, Ds, maybe even the fish oil, which we're going to talk about in a minute, you really need to check with your pharmacist or your doctor because it can interact with the medications that you might already be on, correct?
Very much so. And the common perception that over-the-counter vitamins or over-the-counter medications are harmless is no longer true. Patients come up with 8 and 10 different types of pills that they are taking over the counter, and we don't have clear-cut data to show which pill will interact with which of your medications. So as a general rule of thumb, if you take one multivitamin a day beyond the age of 40, that's sufficient. Your diet should be comprehensive enough that you replenish all the vitamins and other things that you need in order to be heart healthy. The second thing that one has to recognize in terms of vitamin D is exposure to sun. And exposure to sun is the best form of vitamin D that you can get. Yes, in North America, the sun is not of the right kind all the time. And I'm sure some of you have read about there are applications, apps, which will tell you in your area what time the sun is appropriate for you to get the ideal vitamin D. But on the other hand, what is most relevant is to try and limit the over-the-counter medications that you take in order to not have side effects or interactions with the medications that you're already on.
So it sounds like we need to get it in the most natural form that we can before taking anything over the counter. Now we just have a few minutes left and want to really stress too that people need to know the warning signs of a heart attack. So tell us a little bit about how we might know, and I know it can be different for different people, but there are some guidelines.
You have to recognize that heart attack does not always represent as a squeezing pain in the center of the chest. That is indeed the most common way that a heart attack will present, which is pain in the center of the chest that feels as if somebody is sitting on your chest, commonly described as an elephant sitting on your chest, with symptoms of shortness of breath or perspiration or pain radiating to your neck, both sides, or to your left arm. These are a classic form of heart attack. But a fair number of individuals will have very different manifestations of heart attack. They may have only shortness of breath, that is sudden in onset, that gets aggravated by stress or walking, or all they may have is sudden onset of sweating that makes them uncomfortable and makes them short of breath. There are individuals who may have pain only in their left arm or in the back of the chest, which may be a sign of a heart attack. So heart attack can manifest itself in many different ways. It is in women, the atypical features of heart attack are more common than in men. Also, in people who have established diabetes, they may not have the classical manifestation of pain as a form of heart attack because their warning symptoms have been inappropriate because of nerve ending problems that diabetes causes.
Good point. So I think if you feel you're having any of those symptoms, the big thing that we want to stress is obviously calling 911 and not trying to drive yourself to the hospital. So very important to get that prompt intervention as quickly as you can. Dr. Mehta, we really appreciate you sharing this information with us today. We've talked about how an individual, for our viewers, can become a little bit more heart healthy through diet, exercise, make sure they're partnering with their healthcare professional, and knowing their risk factors, what they can do to prevent that, some screenings, and also some current trends that are going on with the treatment. Thank you for your time today. For more information, we'd like you to go to our website at www.hmh.net, and we hope you tune in next month for another important edition of Health in the Heartland.